Clean examination equipment before commencing the exam. Ensure appropriate infection control by decontaminating your hands. Introduce yourself to the patient and check their identity by confirming their name and date of birth. Explain the examination and seek verbal consent to proceed. Consider if a chaperone is required. Assess the patient for any distress or pain and ensure they are well enough for you to proceed. Look for breathlessness and skin changes, including cyanosis, grayness, or pallor. Look around the patient and their bedside environment for clues of the possible problem. Note the warmth of the patient's hands and check the capillary refill time. Inspect for hand signs which may relate to cardiovascular problems, specifically looking for peripheral cyanosis, nail clubbing, splinter hemorrhages, tar staining, xanthomata, Janeway lesions, and Osler nodes. Palpate the radial artery, measuring pulse rate, rhythm, character, and volume. Check for radio-radial delay by feeling both radial pulses simultaneously. Check for a collapsing pulse. First check there is no arm or shoulder pain or restricted movement, then raise the patient's hand above their head whilst palpating the radial artery. Check the elbows for xanthomata. Blood pressure is measured as part of a cardiovascular system exam, however not shown here. Check eyes for conjunctival pallor, looking inside the lower eyelids. Look for corneal arcus and xanthelasma. Look for malar flush. Check inside the mouth for central cyanosis. Measure the jugular venous pressure. Position the patient at 45 degrees with their head supported and turn to the left. Visualize the internal jugular vein JVP pulsation and measure the vertical height from the top of the pulsation to the sternal angle.
I'm just going to push very gently at the base of your neck.
Assess hepatojugular reflux. Palpate the right and left carotid pulses, but not simultaneously, as this can restrict cerebral blood flow. Next, complete precordial examination, which follows an inspect, palpate, auscultate structure. Inspect the chest and axillae for scars. Inspect the chest for deformity, dilated vessels, and visible pulsations. Look for a pacemaker below the left clavicle. Locate the position of the apex beat by palpating in the intercostal spaces, with fingers parallel to the ribs. The normal position is the fifth intercostal space in the midclavicular line. Place the hand flat over the apex region to check for mitral thrill or apical heave. Check for thrills at the other valve auscultation areas by palpating with flat fingers over each area. Check for a left parasternal heave by placing a flat hand over this region during full expiration. Listen to the valve auscultation areas in a logical sequence: aortic area, pulmonary area, tricuspid area, mitral area. Listen for high-frequency sounds and low-frequency sounds at each area. Palpate the carotid during auscultation in order to time any murmurs. Ask the patient to briefly hold their breath and auscultate the carotid arteries for radiating heart murmur and bruit.
And stop breathing again. Good, and just breathe normally now.
Conduct 2 maneuvers which accentuate murmurs. Turn the patient to the left side and auscultate the apex. This accentuates mitral stenosis. Sit the patient forwards whilst they hold their breath in expiration and auscultate over lower left parasternal edge. This accentuates aortic regurgitation. Auscultate the lung bases for crepitations. Check the sacrum for edema. Inspect the legs, noting swelling, colour changes, or skin changes. Look for venous graft scars. Compare the temperature of both legs. Check for peripheral edema. Signs of peripheral arterial or venous disease will prompt a more detailed peripheral vascular examination, including peripheral pulses. Clean the examination equipment you have used. Perform appropriate infection control by decontaminating your hands. Thank the patient, then allow them to dress. Explain your findings to the patient and complete appropriate documentation in the clinical record.